Okay. Hello, and thank you for being here for our second set of panels today. Again, if you missed it the first time, my name is A. David Lewis, and you're here in this room because of my school. It's a pleasure to, yay, MCPHS University, yay, there's Nealie, yay. So here's what we're going to do. We have a mix of full presentations and lightning talks today. Because space is limited, I'm going to invite them up here for their various presentations. We're going to hold questions and answers until the end. If we've timed this correctly, it should all work. Just so you know who you're going to get to hear today, we have Nealie, we have Scarlett, Shiloh, Annika, Mengwall, Briana Martino and Ellen Grabiner, Ellen Amster, Tavon May, and Iris Wren, all joining us today. I believe we're going to start with Annika, if she would join me here at the podium. Yeah, of course. Do you want to be on your own slide duty, or would you like me to? Okay, very good.
So, hello everybody. My name is Annika Mengwall, and I'm going to be talking about striking balance between artistry and accuracy in health education materials. So I'll start by introducing myself. I'm currently a sophomore at Yale University, and I basically have three interests in art, medicine, and education that started in high school. So I was always taking art classes in high school. I also started working as an EMT, responding to 911 calls and driving the ambulance and stuff in high school. And I have always been interested in education, and I was a CPR instructor throughout high school, which kind of tied into the EMS experience. Which that experience teaching CPR inspired me to create my first comic, and that introduced me to the field of graphic medicine, which was to create an educational comic that supports CPR education. So basically, I realized that graphic medicine was a way to combine these three disciplines that I'm really interested in. And now in college, I continue to study all three. I'm majoring in art, I'm doing pre-med, and I'm pursuing a certificate in education studies. And I'm continuing to use graphic medicine to intertwine all these disciplines by making health education materials for doctors primarily. So today I'm going to focus on my two most recent projects, which was a project was a comic handout and graphic poster for the Yale Department of Otolaryngology, which was intended to inform patients in pediatric clinics on the benefits of the HPV vaccine for preventing head and neck cancer. And this is in the final stages of its research trial and like writing the manuscript at this point. So the artwork is done for that. And then my current project is for the Yale Lung Cancer Screening Program, which is basically we're just creating handouts that are intended to inform and encourage smokers over the age of 50 on the benefits of getting a low-dose CT scan for preventing lung cancer. And this, we're still in the artwork development phase, which is kind of tied into intermittent research phases as we're deciding what to do with the artwork. So overall, I wanted to talk about how it's so essential when creating like medical handouts that are comics based to be medically accurate, but also entertaining and creative. And I found that striking a balance between kind of the colder science and the fun creative medium of comics can be especially nuanced in the realm of educational handouts, because you have to be careful as an artist, because the information needs to be strictly conveyed and scientifically accurate, but also as an artist, you want to find spaces for creative freedom within those boundaries. So my goal today is to show how artistry and accuracy can coexist through 4 devices or creative tools that I've personally found to be especially effective, which are developing anthropomorphic characters, using metaphorical visuals, employing creative lettering and coloring, and using a scientific narrative voice to drive more creative visuals. So in all of these ways, you can facilitate a balance between artistry and accuracy and adhering to the frameworks of science, and also in those ways help facilitate communication to patients. So the first topic I'm going to talk about is anthropomorphism, or just the development of non-human characters that have human characteristics. And this benefits the artists because they can preserve their creativity as they design their own characters, but it also benefits the doctor-patient relationship because these characters can create humor and introduce a storyline. And then also, they transcend issues of race, age, and even sex, which is often a concern when doctors are trying to choose an inclusive representative for their health communication. Using an anthropomorphic character can be an easy solution for that. So I'm going to give some examples. These first two examples are from my HPV comic. So this first guy was this HPV virus, which I had a lot of fun designing based on what the actual virus looked like, and also giving him an anthropomorphic vibe, but also with an angry demeanor that carried throughout the comic. And also, this other character only appeared once, but it was solving an awkward issue raised by the doctors about how to represent a cervix in the discussion of cervical cancer. And while this isn't directly an image of the cervix, I thought that this was a way to interpret the female anatomy into a character that can still be used and understood for that discussion. And third is for the lung cancer screening comic. I created this character of a older couple of lungs that are stuck together, and they represent the target population for lung cancer screening, which is males and females over the age of 50. So this married couple introduces narrative because you can make stories about an older married couple, but they're also ambiguous enough to be understood and related to in other ways. So one challenge I wanted to raise with anthropomorphism is that sometimes the characters aren't suitable for discussion of human anatomy. So in the lung cancer screening comic, I realized that we needed to show the human body as it goes through the CT scan machine, and the proportions of the lung character I'd made just weren't conducive to that. So this was just a solution that I came up with, which is still leaves enough ambiguity and doesn't introduce like a superhuman character, but it still integrates the character that I wanted and shows how the human body moves through the machine. And it ended up almost inadvertently being extra helpful because placing the lung character inside showed why you stop halfway between the machine, because the lungs need to align with the machine. So that was just something to consider. My second device is visual metaphor. So this benefits artists who can preserve their creativity because they can develop metaphors that they want to draw, but it also benefits the patient understanding because metaphors can facilitate education in a lot of different ways and be super helpful in teaching. And one thing to note though is this does require communication with the doctors and the artists, because sometimes the metaphor can be at the expense of accuracy. So you have to decide to what extent is my patient going to actually understand all the details of this idea. So for example, for my HPV comic, the doctors wanted to discuss this idea that the HPV virus can infect you and you don't know that you have it. And that creates an issue because a lot of people can have it. So I put the HPV in this disguise. And obviously this is not how it works, but it just emphasizes the idea that they wanted to communicate about HPV being a hard virus to know that you have it. And secondly, also the way that HPV affects the throat. I show it like walking into a throat. Again, that's very metaphorical, but it still communicates enough of what the patients need to understand and the impacts of the HPV vaccine on attacking the virus and keeping the cervix and the throat safe. The virus itself doesn't work this way. It doesn't do martial arts, but it still communicates enough of what the patients need to understand in this context. Another visual metaphor example is from my lung cancer screening topic. So this one is about the CT scan. I wanted to emphasize that they take 3 images when you get your scan because you have to move into the scan 3 times. And the way that I created a little metaphor at the end just to further establish that was to introduce this photo spoof style strip of the lungs. It's still very sketchy. I don't know if you can see, but the couple is like doing funny things you would do in a photo booth. Obviously, that's not how the scans look, but and the patient doesn't need to understand the scans. They just need to really know that you get 3 photos. And on the right, we wanted to create a one-panel handout that would plant a seed in viewers to consider their lung health. And this is more of an example of a revision that we had to make because I went a little too far into a metaphor, where this was the first one I made. So the lung couple is at couples therapy, and one of them is saying, I just have not felt seen. And then the therapist is here recommending that they go get a low-dose CT scan, and it only takes 5 minutes. And while it is humorous, the physicians were a little worried because it doesn't directly say lung cancer at all in the image. So maybe it's a little too ambiguous. And then we revised it, so now they're at a doctor's office, and the lung is saying, we're worried we might get lung cancer, and he says the same thing. So it still communicates how fast the scan is, and that it can be a useful tool, but yes. So the third device is lettering and coloring. This preserves scientific accuracy because you can use the word-for-word language of the doctors that they approve of, but infuse artistry and creativity to come up with fonts and colors to make it more interesting to look at. And it also can be more engaging for readers. So these are 2 examples. The first one is from my HPV comic. So there was this awkward issue because parents and patients that were visiting their pediatric ear, nose, and throat doctor weren't necessarily expecting to talk about a sexually transmitted infection. And the doctors wanted to wonder how they could touch on that idea without getting too far into it. And so we met up and they approved of this exact language, which is HPV is primarily transmitted through close contact with others. So vaccination is encouraged prior to any intimate activity. And the way that I transformed that with lettering and colors was through making this little panel. And the main thing I want to emphasize is using this loopy font with the little hearts over the eyes for an intimate activity, which drives home the idea of talking about intimate activity without really saying much more than what the doctors wanted to say word for word. Another example was for the lung cancer screening comic. So we wanted to develop a handout that people could give to loved ones who they wanted to get lung cancer screening. So they approved of this language again, and they sent it to me. And then I turned it into this little postcard that people can fill in and give to loved ones. And we took those words and used a vertical format, horizontal format, differentiation in the fonts, and overall kind of structure of the page to transform the message to be more visually interesting. One extra note I wanted to note about the use of color and lettering is that you can think about infusing, if your handouts are aligned with an institution, you think about infusing the brand of the institution into your comic, which can help make it seem more trustworthy and legitimate and also look more professional, because sometimes there's an issue of comics being accepted as a super professional, trustworthy resource in clinical contexts. So I like to copy this logo and I reference the brand guidelines for the institution that I align with, and I limit myself to the color palette here.
The thing I like about that is that it makes their logo a little more fun.
Thank you.
Yes.
And the final device I want to talk about is narrative voice. So this is specifically addressing using a scientific narrator that's guiding more artistic illustrations that kind of reiterate the scientific voice to serve the public. So these are examples from the HPV comic. On the left, the physicians wanted to include the statistical fact about the prevalence of HPV. And I did the same thing we just discussed with the lettering and coloring using their word-for-word language, but then I also coupled that scientific narrator with this more interesting visual. Instead of doing a statistical kind of visual, I decided to make it more personal by showing the HPV comic zipping around your doctor, your friend, and your parent. And then here again, they wanted to create a poster that can be hung up in the clinic to promote the HPV vaccine. And they gave me the exact words they wanted to include on it. And I rearranged them, did the lettering and coloring, but then I also included the visuals and my drawings of the little vaccine guys to further drive home the idea of the HPV vaccine as like a superhero. And the final example is for my lung cancer screening comic. So This is header over here. If you are over 50 and have smoked cigarettes, you may be eligible for lung cancer screening. That was something that doctors had worked through, exactly worded carefully, and sent to me that they wanted to have on the handout. And then we developed this 4-panel comic that goes underneath this message that basically reiterates the same thing, but in a more humorous and relatable way with this long character I've introduced. I can read through it. So they say, so we're over 50 now, don't remind me, and we've smoked cigarettes. Define smoked. I'm just saying that means we may be eligible for lung cancer screening. Okay, well, now what? And this, not only is it more relatable maybe, or interesting to look at, but it leads into the information below, which was the next steps on what to take. One final note I want to mention as I'm wrapping up is the value and importance of research, especially in this domain, at the intersection of graphic medicine, medicine, and education, which are all fields that are founded and rely on research. So developing like these handouts is really interesting to me, but also I think an important second step is always to research the efficacy of these comics in health education context, just to solidify that they are useful and to improve the outlook of them in these other fields, especially medicine and education. And also, they can introduce graphic medicine into other fields. For example, our HPV vaccine, even that research was accepted to present at several otolaryngology conferences, which then introduced the field of graphic medicine to doctors that had never heard of it before. So just wrapping up, the takeaways are that graphic medicine can allow for the harsh and maybe sterile scientific messages to be communicated and reframed into something that's more relatable and engaging by allowing artistry. But we have to balance that accuracy and creative artistry when making these things. And the devices I discussed are anthropomorphic characters, metaphorical visuals, creative lettering, coloring, and maintaining a scientific narrative voice. But these are all just the ways that I noticed ways to balance these two things, and I'm sure there are many more. And yeah, that's it.
Okay, we would now like to invite up Ellen Amster to present 20,000 Leagues Under the Hospital using comics to explore race and colonialism in medical education and clinical practice. And Ellen, I'll be in the corner signaling you for time.
Okay,
Thank you.
so they said 5 minutes. I'm gonna try to be 5 minutes.
Yes.
Hi, everyone. I am a historian in medical school. So this project started in 2020 when one of the only 3 Black students in our student body of 613 asked me to give a lecture on the history of race and colonialism in medicine, which I did. She felt intuitively that history was an answer to issues that she faced in medicine, like these Black medical students at Tulane who had themselves photographed in front of a slave cabin on a plantation. So she and her fellow students involved me in their struggle to change their program. So their petition, which first got blown off, had 1,600 signatures and was one step toward getting a Black recruitment stream, which we now have. I asked them after my lecture if other students shared their point of view, and they said, well, sometimes I look around during the Indigenous health lecture and I see other people like watching a hockey game on laptop. And I said, what's going on with those people? And they said, I don't know, but it makes me really mad. And those guys are the ones who need the lecture most of all. And so I said, why don't we do an interview project? So I interviewed 44 medical students to see how they are encountering race and colonialism in medical education and the clinic. And that's this on the bottom. So the characters in the comic are composites of the students that I interviewed, and dialogue is sometimes taken verbatim from transcript. And then some of them are also modeled on the this student, Kika, and some of her friends. So I realized that what seemed to me like fragments the history of medicine that I research, recent scandals of patient mistreatment, the dethroning of some great men of medicine like Marion Sims, students' experiences in clinic, and the rise of fascism in North America and Europe are all interconnected realities. In fact, they are elements of a single story, the past, present, and future of race and colonialism in medicine. So I published this idea as a brief article in the Canadian Medical Association Journal, and I was surprised to see that it now has 40 citations in health research literature and is in 2 policy documents, one from the WHO and the other from Oxfam. And I was like, I slaved over my book for 15 years. How come I just write something brief and it has this kind of impact? But I said, how, we need to decolonize medicine, but like, what are we supposed to do exactly? Right? The students are like, what does that mean? What am I going to do? Right? To it. What does that mean in practice? So for me, comics were the answer. The way we show that the past is present, first there's a frame story. A group of 5 medical students are in the break room discussing their clinical experiences when suddenly an earthquake splits the floor of the hospital, literally shattering the great white men and the great white accomplishments narrative of medical history. The students descend under the hospital to discover histories of colonialism and race, how they shaped public health, like Tuskegee, nutrition experiments on indigenous children, eugenics, how they shaped medical knowledge itself, and how much agency individual physicians have. From my work on Morocco, how non-Western people co-opted or fought colonial science, and histories of women and other doctors. So the medical students provide reflections on these histories, like Tuskegee, the ways that many small decisions by institutions and agencies and individuals produce these kinds of outcomes. So it's not one evil doctor vampire, it's actually a system very similar to now, and that's why the same things are happening in a different way. So physicians nevertheless have agency either to advance themselves, like Marion Sims, or to resist, like Peter Bryce in Canada. So this 2-page spread about Marion Sims is one example of how comics can support history. We can use concrete objects and examples. In this case, this is his actual memoir. And the visuals in this comic reference a famous painting of Marion Sims with patients. And then there's also, so comics are a gateway to history scholarship, and history shifts the physician's perspective on medical research and clinical practice. Comics allow us to leap across space and time. So this is a visual that draws on the protest that brought down the Sims statue. And then the part 3 is back in the hospital, the experiences of medical learners in clinic, and deals with some recent cases like Joyce Echaquan, an Indigenous woman who died in hospital. There's also the metaphor of an evil plant. We're still working on the evil plant. I'm almost done. So there's another important aspect is stories of how women and Black people became doctors. So it's not the lone pioneer who does everything. The past has action plans for us today. Today's trainees are racially diverse and 50% female. Most don't see themselves in the great white men of medicine. Instead, I propose we rethink who is a hero and what we look up to in medicine, and recovering these hidden social histories of medicine shows us how change happens. So to conclude, history helps us to build structural competency in medical learners, as Jonathan Metzl has argued, and comics have been part of medicine from the beginning. This history also merits exploration. I actually use this 1884 comic for teaching the history of pandemic. And this is a quick outline of the book. And I hope that's within 5 minutes. Thank you.
Moving right up, and Ellen thanks you, and that's her email, all the way from Canada. And yeah, when you said they were watching hockey on their phones, that's what gave it away. That's what gave it away. I'd like to invite up Nealie No for another lightning talk, creating comics about psychotropic medications for kids. Nealie.
Okay, 5 minutes. Okay, cool. So my name is Nealie. I'm currently a PGY3 psychiatry resident across the river over at Cambridge Health Alliance. And I love graphic medicine. I also got my start when I was at Yale. And I did it kind of through medical school, was sort of my saving grace throughout medical school, and happy to continue doing it as a resident. So I'm going to talk about this project that I'm working on right now in residency. I'm doing this project as part of the APA SAMHSA minority grant, which is awesome. So shout out to them for giving me funding for this. But basically, as a psych resident, my kind of big picture goal is to do child psychiatry. So I'm thinking about doing fellowship. And as part of sort of my work, I'm really interested in like health education, medical education, and doing sort of kind of research into this. I was looking at what resources like kids in particular had in regards to medications, because that's one of the things that we kind of use in psychiatry to treat patients, and found that there weren't really a lot of resources for kids specifically about medications. It's mainly targeted towards parents, or if there are kind of resources more about like therapy, how do you relate yourself with like other kids, kind of things like that. So kind of looking at that was a gap. That's what I wanted to kind of focus on. And so my idea for this project was to make sort of like a collection of small comics about different psychotropic medicine classes. So like the SSRIs, like the antidepressants, anti-anxiolytics, to kind of like antipsychotics, things that we would typically use to treat child patients. So looking at that kind of gap, I wanted to write it for children aged 5 to 10, so pretty young. And my kind of goals for the project are to kind of increase knowledge about medications that kids might need to take, understand side effects that they might be exposed to, and to kind of decrease stigma surrounding medications. And my big picture ideas for the comics at that, they're going to be interactive. So there are places that kids can like write their name. They can write like the name of like their doctor. They can write the name of their medications, what the medication is supposed to help them with, what things they need to watch out for. And with the comic, I wanted to make everything black and white. So kind of in a visit with the kid, we can give the kid like the comic and like crayons for them to be able to use it as like a coloring book. So I started working on this. So would also love thoughts and feedback. But that's sort of kind of what I was thinking about for the project. And kind of thinking about how to put this project in the context of other resources that are already out there. ACAP, which is like the child psychiatry organization, and the APA, which is like the kind of general psychiatry organization, has these things called parent medication guides. And these are obviously targeted towards parents. And they talk a lot about what kind of medications are used for different things, what the side effects are, kind of things that parents and kids need to work out for. So my idea is to kind of with these comics, it could be something, we give this to the parents when they come to the visit, and I can also give the kid a comic so they can sort of learn together and sort of kind of understand like what it means to kind of go through clinic and stuff like that in regards to the medication. So maybe the more fun part of the talk. This is the stuff that I kind of have going on right now, sort of in the drafting kind of stage, but kind of thinking about little characters I can use to represent like a kid's brain, making it interactive. I think my hardest thing right now is writing for kids aged 5 to 10. So that's sort of kind of what I'm working at, but this is sort of kind of the aesthetic I'm kind of thinking about. And this is like a draft and maybe how it would start out. And so for each of the kind of comics, each of them talk about a different medication class, but they all are kind of tied in with a unified narrative, unified characters, kind of thinking about, should I explain it through these kind of like chemicals that exist in our brain? Because that's what the medications sort of help increase or decrease or sort of modulate. But that's sort of where I'm at right now in terms of where I'm at in the process. So that's me.
Nealie did my job for me. We're going to have both Briana Martino and Ellen Grabiner from the upcoming edited collection that I'm part of, Keyimages, keywords and key images in graphic medicine. So please.
Hi everyone, it's great to be here with my dear friend, Ellen Grabiner. In 2019, Dr. Lisa Diedrich, professor of women's gender and sexuality studies at Stony Brook University in New York, and I began work on a book project that would come to be called Keywords/Key Images in Graphic Medicine. We coined the term keywords/key images to capture what is unique about the comics form. We generated a list of keywords and key images that would provide a snapshot of the field of graphic medicine in action, and that would demonstrate rather than definitively designate the field. We asked comics artists, critics, and academics, and health practitioners and advocates to submit their own ideas for keywords/key images. We were really determined that the collection emerge organically and collaboratively to reflect the transdisciplinary nature of the project and of the field. And the book is now scheduled for release from Penn State University Press in early 2026. So I will briefly introduce the project on behalf of myself and my co-editor, Lisa Diedrich, before moving on to showcase one of the book's 37 chapters, Picturing, a keyword/key image conceived and presented by Dr. Ellen Grabiner, professor emeriti at Simmons, who joins me here today. Graphic medicine. Okay, so in the introduction to keywords/key images in graphic medicine, Lisa Diedrich and I considered the link, both historically and methodologically, between the emergence of graphic medicine and the emergence of narrative medicine, one of the key methods of the interdisciplinary field of the medical or health humanities. Michael J. Green and Kimberly R. Myers in 2010 pointed to the role that graphic narratives can play for narrative medicine and health humanities, as these have become important resources for communicating a range of ethical and clinical issues related to the experience of illness. This hybrid verbal visual form they maintain helps medical practitioners, patients, family, and caregivers creatively reimagine the boundaries of health, illness, life, and death. As Ian Williams, who is the creator of the book's cover and who coined the term graphic medicine, has clarified, the medicine in graphic medicine is not only a reference to the institution of medicine, but also understood more broadly as a form of care and a kind of remedy for transforming individuals and institutions more generally. We thus see graphic medicine comics as symptomatic texts of our time. That is, texts that literally describe symptoms and struggle with finding a form to describe the affective and physical experience of symptoms. And texts that describe illness as an event that goes beyond any individual's experience and account of it, reflecting wider sociocultural categories, including race, class, and sexuality. There we go. Okay. The inspiration for our approach is the influential work Keywords, a vocabulary of culture and society from 1976 by literary and cultural studies scholar Raymond Williams. In his introduction to Keywords, Williams writes of finding himself, quote, preoccupied by a single word, culture, which it seemed I was hearing very much more often, end quote. His preoccupation with the word culture led to an inquiry into, quote, several urgent contemporary problems, end quote, as a means to make an intervention into the present historical conjuncture. Williams' method would drive the emergence and enactment of the interdisciplinary field we now call cultural studies. He writes of approaching, quote, words as a kind of structure, end quote, where one word leads to many others, expanding his collection of keywords from his vocabulary of culture and society, first culture, then class, art, industry, democracy, and so on. Williams was emphatic that his Keywords project was, quote, not a neutral review of meanings, end quote, Rather, he described it as, quote, a shaping and reshaping in real circumstances and from profoundly different and important points of view. A vocabulary to use, to find our ways in, to change as we find it necessary to change it, and as we go on making our own language and history, end quote. The real circumstances of clinical medicine, healthcare, illness, disability, and trauma, and the profoundly different and important points of view that make up these real circumstances provide the basis for our collaborative exploration of keywords/key images in graphic medicine. While it has become common practice for scholars to use keywords and concepts to situate and orient a field or a subfield, and I can give you many examples of this, we realized that the keywords framework risked reducing graphic medicine to only one component of its form. As comics scholar Scott McCloud articulates, the imbrication of words and images so central to graphic narratives as more alchemy than science. What they generate together is both greater than and different from the sum of their parts. To indicate the significance of images separate from and in relation to words, we created two neologisms, key images and keywords/key images. We use key images as an analog term to keywords, a way to capture how specific images operate as a kind of structure in graphic medicine, outside of an analysis or narrative description of them. Key images are the visual tropes and iconography used by comics artists in their work, as well as aspects of the comics form that help create the vocabulary of graphic medicine. While keywords and key images may offer independent insights, keywords/key images foregrounds the work in relation. By foregrounding keywords and key images together, our book approaches reading as both/and. Both words and images, both visual condensation and verbal elaboration, both sequentially and simultaneously. The contributions that we received demonstrate the value of this both and reading practice to artists, cultural critics, health practitioners, as well as people dealing with the experience of illness in their everyday lives. So we've organized the contributions into 5 sections, which are listed here. And at the end of each chapter, we also offer links between other keywords/key images in a chapter, as well as ones that didn't make it into the book that we're hoping folks might elaborate upon themselves. 2 shout outs here to Dave Lewis, who's here today, who has a chapter in the book on cancer, a brilliant chapter, and also Monica Chu, who is in New Hampshire, a chapter on scars. So those are our New England folks, in addition to Ellen Grabiner, who will join you.
Thank you. I want to start by thanking Briana for inviting me to be part of this panel at the summit, and for their groundbreaking work with Lisa Diedrich that resulted in this amazing book that I can't wait to get my hands on. Okay. As a visual artist who delights in stringing words together and a writer who thinks in pictures, I have inhabited and argued for a liminal space that fluxes the verbal and the visual for the bulk of my adult life. Many arguments there. When I discovered the work of W.J.T. Mitchell, particularly his book Picture Theory, my experience of the permeability of the border between word and image was validated. Mitchell states, quote, "The very notion of a theory of pictures suggests an attempt to master the field of visual representation with a verbal discourse," end of quote. He then flips this notion on its head by supposing, quote, "We reverse the power relations of discourse and field, consequently resulting in a process of picturing theory." We can't help but make up stories about the pictures we see, and we can't help but picture what language describes to us. In my essay, Picturing, I attempt to deconstruct the process that undergirds the making of a graphic narrative. Situated in the historical moment of the early 1980s, before the days of online sperm banks, before same-sex adoption or marriage were legalized, Piece of Cake, a graphic memoir, chronicles the story of lesbians quietly queering family. In the brief time that we have today, I'd like to focus on just one image from Piece of Cake and unpack the multi-layered process I went through in its making. But first, a little bit of context to set the scene. Since in 1984, there were no sperm banks that would allow unmarried women, let alone lesbians, to take advantage of them, the choice to get pregnant required finding a willing friend, an ex-boyfriend, a friend that lives in Australia, for those of you who were here earlier, a cousin or partner or cousin of the partner to supply sperm. However, I was really fortunate to locate the practice of an OBGYN, let's call him Dr. Doctor, in the Boston area, who was committed to making sperm accessible to lesbians choosing to conceive. He had established a small insemination program, and for my third round in trying to get pregnant, my then partner Susan and I decided we would inseminate in the doctor's office with his assistance. We got there on time. We were waiting for Dr. Doctor to also get there, sperm in tow, when his nurse told us he had gotten held up at the hospital. Already anxious, this new piece of information left me picturing the death of any viable sperm that may have been on their way to spermy heaven. When Dr. Doctor finally did get there with the sperm still swimming, his excuse that he got held up at the hospital did little to clarify, and it only heightened my anxiety. When he sensed that I was a little anxious, Dr. Doctor explains that the donor, too, was a doctor, Dr. Donor. And still in the dark, I pondered or pictured how the handoff might have happened at the hospital. So here's the comic page. I don't know if you can read it in the back, so I will just quickly read it to you. The fact that our donor was a Jewish doctor was a total cliche, but I was so relieved that we had viable sperm at all. I was giddy. Here's how I pictured it. Ben Casey meets Dr. Kildare. Dr. Donor is with a patient. Well, Mrs. McGillicuddy, why don't you start by telling me when you first noticed these palpitations? And then Dr. Doctor breaks in suddenly. Dr. Donor, Dr. Doctor, now. The young, excruciating, handsome, and kindly Dr. Donor politely excuses himself from his patient's palpitating heart and hightails it to the nearest doctor's job. He hands off the fruits of his labor to Dr. Doctor, and voila. Good, fun. Okay, in the process of making the page that reflects the wild flight of fancy I took while lying on the table in the doctor's office, I drew upon what Scott McCloud calls amplification by simplification, a reductive reliance on often cliched distilled symbols, the established and familiar conventions that are the meat and potatoes of visual storytelling. All of our picturing is, of course, culturally constructed, shot through with images from picture books, cartoons, comics, films, TVs, and memes, and rife with reductives, efficacy, and logic. It is the recognition of these very signs and symbols that allows meaning to flow between the maker and the reader. When one is writing/drawing a graphic narrative, picturing becomes a verb with at least two meanings. The first is the traditional understanding. I picture, that is, I imagine how Dr. Doctor got a cup of semen from Dr. Donor. But I am also picturing, in other words, bringing a picture into being where there once was none. It is not a stretch to suggest that picturing, the process of making thought, memory, or imagination visible, is at the heart of all narrative. While Piece of Cake is comprised of many two-page spreads that feature a single image This key image, by contrast, is constructed as a traditional 4-panel comic narrative. It uses traditional comic conventions of storytelling, including signifying images in sequence separated by a gutter, which points to the passage of time. This canonic form has been thoroughly analyzed, and readers know how to navigate it with ease. Within the panel structure, my imaginings, in a large part colored by the absorption of decades of comic and cartoon cliches, work. That is, they point to the medical profession effectively. In what might conform to an establishing shot, we find the handsome, kindly Dr. Donor. To signal that he's a doctor, I draw on a stereotypical reflective head mirror, which is archaic and we don't ever see anymore. But it does the trick. The placements of containers of cotton balls, stun depressors, and tissues flesh out our location at the doctor's office. The ludicrousness of Dr. interrupting Dr. Donor with his patient notwithstanding, I plow ahead, elaborating on the small bit of information that I have about how the handoff might have transpired. This entire imagined scenario sits in panels that are circumscribed by wavy frames, a comic convention that indicates that the scene is not something that actually occurred. The wavy paneled frames underscore the process of picturing. I have pictured my picturing. In the third panel, we are given Dr. Donor, a Playboy magazine, and a small shape signifying the handle of the toilet. The doctor, the bathroom, and the magazine give us sufficient information so that when we arrive at the final panel, a close-up of the plastic receptacle for the semen, we imagine the temporal connection between the reading of the Playboy magazine and the handoff of the plastic cup. We can't help but picture what has occurred during the time indicated by the gutter between those panels. Since the 1980s, IVF has become commonplace as the practice of sperm donation, tests for motility, etc., and consequently these have been regularly signified in films, TV, and streaming series. Playboy and other soft porn magazines, videos, private rooms conducive to masturbation now populate our common lexicon. But decades ago, this was not the case. The clinical sterile semen cup pictured in the final panel belies some of the more creative sperm delivery systems devised outside the act of heterosexual sex, like turkey basters, Grey Poupon mustard jars, and comprise part of the rich lore of the alterity of the queer family. In my story, the lowly specimen cup is elevated to a tongue-in-cheek place of pride, denoting the retro analog album replete with photo corners, a family portrait of Dad. You can just picture it.
Ellen, when did this come out? What year?
It has not come out.
Oh, we can look forward to it. Okay, good.
Still on the table.
Excellent. Something to look forward to. Thank you very much. Now, we're going to switch gears just slightly. Excuse me while I deal some, we're going to ask Scarlett Shiloh to come up to present on their communicating previvorship in zines and graphic memoirs. Give me just one moment so I can open it in a slightly nicer format.
Just stand here awkwardly with my thumbs up.
Well, that's less good. So we'll stick with this format if that's
Yeah,
okay by you.
that's fine.
Would you like me to operate up here or would you like to take the?
I can take it.
Okay.
I might zoom in a little just so I don't spoil
Please do.
every. Okay. All right. Google Docs is so weird about this. Okay. Hi, everyone. My name's Scarlett Shiloh. I am a graphic memoirist, and current student of public health at Boston University. I have an arts background. I went to Emerson College, and I then I got a certificate in communication design from Mass College of Art. I've been kind of all over the place. I'm trans and neurodivergent. And I have actually, I'm going to ask a question. How many of you have heard of the term previvor? Awesome. And I am what's called a previvor, which means I'm actually going to explain a little bit before I do an info dump. A previvor is someone who is predispositioned to cancer, either with a strong family history or with certain genetic conditions, such as BRCA or, like myself, Lynch syndrome. My personal experience, I've been doing comics since childhood, and I moved kind of to graphic memoirs since like 2006 or 17. I focused mainly on my struggles with mental illness, including dissociation and borderline personality disorder, along with various travelogues. And then I got diagnosed with Lynch syndrome and an ATM mutation, which means I'm at high risk for a lot of cancers. My GYN oncologist once referred to my uterus as a ticking time clock, so that's great. And then I'm at then there was a few that I'm at moderate risk for. There are a bunch of screenings that I have to get regularly. Yearly colonoscopies are the most prominent one. A lot of people wince when I tell them that. I actually recently finished a zine published through Microcosm about navigating the colonoscopy prep experience for neurodivergent people. Amongst that, I also have to get a hysterectomy, which is coming up soon, and other procedures, upper endoscopies, breast MRIs, a lot of other stuff. So what is previvorship? I'm sorry the slide is like this. It's not my fault. It's Microsoft's fault. Like I said, a previvor is someone who is dispositioned to cancer due to genetics, family history, but who has not had a cancer diagnosis yet. There are a lot of primary concerns of previvorship. A lot of them come to something called scanxiety. Scanxiety is anxiety with regards to cancer screenings and waiting for results, either with anticipation up to a test or after the test waiting for results. Complex family planning, if someone has a risk of ovarian, endometrial, or otherwise, or breast cancer. Similarly, there might be like considerations around IVF. There might be considerations around embryo testing. Sometimes a lot of previvors have worsened depression and anxiety, especially in the first months of diagnosis, and especially if a previvor has seen a family member have cancer. I watched my father go through some pretty grueling cancer procedures. Also another thing is medical trauma and PTSD, something that's not really talked about within the trauma spaces. When you have to get constant testing, sometimes that becomes very overwhelming, especially if these tests are painful or uncomfortable, and sometimes that can manifest as PTSD. So, if it isn't clear, this is something that's extremely scary and anxiety provoking. I don't know if y'all can tell that. Well, my first few years actually after being diagnosed were honestly some of the hardest of my life. I basically had to get like a new perspective on life. There were a lot of things that I was terrified of that I had to figure out ways to do anyways. Colonoscopies being the main one, endometrial biopsies, all that other stuff, all stuff that it was like, I can avoid this, and then, oh, I can't avoid this. That sucks. But comics are a great way to express that awareness and spread anxiety. Both for readers and for artists like myself. I don't know why I made this a list. So mental health conditions that can be exacerbated by a genetic cancer diagnosis, basically everything. A lot of these experiences trigger very deep anxiety. When you are kind of confronted with the fact that, oh shit, my family has had these experiences. Some of my family members have died young. Some of my family members have had a horrible quality of life, and now I'm at risk for that. It is very stressful, especially if you are already predisposed, especially if you already have a mental illness or anxiety of any sort. Two common topics for previvorship related comments I see are anticipatory fear and anxiety, as I mentioned, scanxiety. There are a lot of well-known CBT or DBT cognitive behavioral and dialectical behavioral therapy skills that can help anxiety, but some are more ineffective. For instance, there are a lot of skills that try to limit catastrophizing thoughts, like what if I wake up from my colonoscopy and I have cancer? For a lot of people, there might be like a therapist telling you, oh, there's like ways you can like minimize that fear, but when it's an actual possibility, it's a little less effective. There are a lot of high emotions and stressful situations, and often comics and graphic memoirs are ways for people to talk about their stressful experiences. The second thing I kind of see is unpleasant scans or procedures. I'm talking about mammograms, colonoscopies, biopsies. For many previvors, they have to get these procedures often earlier or more regularly than other people. And sometimes a lot of people in social circles tend to, I guess, underestimate that sort of severity and fear, and they may kind of make out of place comparisons like, oh, I understand what you're going through because I had these stomach problems. It's like, I appreciate your attempt to empathize. They are not the same thing. And sometimes this can be very isolating. So I've done a few standalone art pieces. Oftentimes these convey a moment in time or specific feeling. This one I call Genetic Chaos in Motion and was one of my first art pieces with regards to previvorship. I went with kind of like the flowers replacing some strands of DNA, my very accurate DNA strand. It's so medically accurate. And then I love birds, and I kind of felt like my life was moving very fastly. So I had these birds circling around it. And this ad actually won an award at my college. The health competition for health communication. I did like kind of a train ad for like colonoscopy awareness. And I wanted to make it like sort of targeted to younger people, like age 20 to 35. And I thought that mixing humor into it and putting it on like the MBTA would be like particularly effective. So yeah, it's the one time you get to moon your doctor, I think. There are also wait, go back. Don't spoil. Oftentimes longer projects can feel inaccessible and take a long time to create, and especially when it's about a very emotionally charged topic. So from my experience, doing like zines and smaller comics and smaller pieces has been more effective at getting me to like say like, this is what being a provider is like, these are some struggles I'm having. And sometimes these shorter mini comics can often provide the catharsis that some previvors need. There's this one app I really love called Electric Zine Maker. It is yes in all caps. And it's it's very good for making these very quirky and like all over the place zines. And sometimes like you just gotta have fun with what you have, and it's like yeah, my experience sucks, but look, I made a 2008 meme about it with the DNA strand going, it's not a phase, mom, roar XD. So that's one of the things that I like doing a lot. I know that it looks silly, but I feel like this is something that just it like not only helps me go like, okay, I've expressed some things, it's also like, oh, I've made something that I can show to people. It looks pretty. I also like doing collage zines. Collage comics are a little bit less well known, but I love doing them. This was done for the International Zine Day of 2022, which was the year I was diagnosed. And they can be a lot easier to throw together, especially on a time crunch, and especially when you just have something that you need to get out of your system now. And it's and you can kind of like cover a lot of ground and like put quotes everywhere, put like stickers you have laying around. And I really like to doing this because like similarly to small zines and small art pieces, it's a relatively quick way to get my points and my feelings across. And I think this was actually the first like longer piece I made about my experience. And I just finished another mini comic, kind of on the spot. I was just kind of doodling and then it turned into an 8-page comic. I think all of us have had that experience. So I'm getting my hysterectomy like in like a week, and that's been something that's very stressful for me. A lot of my friends in the trans community, I guess, no fault of theirs, but kind of assume it's because I'm getting bottom surgery as a gender affirming procedure, and it's hard to explain that like no, unfortunately that's not the case. I also I've been stressing about this decision for years. There were many factors that I considered. I considered alternate cancer screenings. I considered IVF. I considered like what the state of reproductive rights and trans rights are like in the country right now. And I experienced like suddenly wanting to have kids and then suddenly not being able to have that option. And I took a lot of inspiration from one of my favorite graphic memoirs called I'm a Terminal Cancer Patient, but I'm Fine, which is done by which is actually a manga, and it's done by a Boys Love manga artist. It's really great. That's where I got kind of the like anthropomorphism in. I got a lot of pushback both from friends and well-meaning family members who kind of wanted me to wait and like consider my options a little more. I think a lot of this comes down to us being Jewish and this being kind of like a cultural Jewish thing where like it's like kind of like expected for you to have more Jewish children and raise more Jewish kids. So now that I am going to be unable to have Jewish kids, it's I got a lot of pushback from my family and like well-meaning friends. And it's frustrating because these are all like things I've considered and all things I've given back arguments for, like IVF. I had like a really extensive appointment with a fertility doctor where she covered in depth the costs and like the emotional and physical like nature of IVF. And I also experienced a lot of like, I guess, assumptions. Like my trans friends didn't really understand the genetic cancer experience, and my friends in the genetic cancer experience didn't really understand being trans. And that left me in this kind of very weird middle where I was trying to say, like, well, it's not exactly like that, but it's kind of like that. And like right now, trans rights in the US are pretty rough, and my fear was I have a feeling things are going to get worse, and I want to do this before before I don't have the option anymore. These are some of my favorite graphic novels about cancer. I haven't done a full length one, but I really want to someday. This is the comic I just talked about. This one is more like a lot of comic strips about it's a lot of these are very like I get not sarcastic but done in a very ironic and humorous tone. Crazy Sexy Cancer Patient, Crazy Sexy Cancer. I think the title I saw was different anyways. Is oh, this is the DVD. There's a comic version of it that's also a collage, and it's really funny, and I love the artist's voice. And then Kimiko Does Cancer talks a lot about like how like a lot of cancer support groups are very white centric and like cis het female centric, and how that was very isolating for her. In conclusion, Previvorship is emotionally loaded. It's isolating, and it's a subject that's difficult to communicate with others. Making comics, art, and zines oftentimes helps us just visualize those experiences. And personal narratives can be difficult to find, especially when like finding narratives outside of kind of the mainstream one. And this is a pin I saw at Prudential when I was like 15. When words fail, art speaks. Thank you for listening. This is my cat.
All right, we have one more set of speakers today. Let me make sure I have their panel loaded correctly. 1 second, please. I think we've heard some really great works today. I'm so pleased. I'd like to invite up Tavon May and Iris Wren from the BU Graphic Medicine Club.
Hello, everyone.
Hi. Hi.
I'm Iris. I'm a junior at BU studying computer science and education.
And my name is Tavon, and I'm a senior at Boston University studying human physiology. And today we'll be talking about how Graphic Medicine Club, or GMC, transitioned from defining our mission, our core values, and our core events into eventually posting a platform to empower youth and undergrads through medical literacy. Okay, so starting a little bit with our origins. So a Graphic Medicine Club is a very young club. We were founded in the fall of 2023. And here's some origin photos from our first general body meeting. We were set with the mission to essentially take complex medical topics and to break it down into something that's easier to digest and more comprehensible for wide audiences with diverse knowledge levels and backgrounds. But one core aspect that we explored and eventually developed was the use of graphic medicine as a tool and its power to educate and storytell. So one thing that we did to explore that was create our own spin-off of book club, Coco and Comics. So I want to bring in one particular example. We explored a book called My Degeneration, A Journey Through Parkinson's, where the author, Peter Dunlop-Shohill, talks about his experience with Parkinson's, which is a chronic neurodegenerative disease. Students got to learn a little bit about the book, a little bit about his life, the condition, and then followed by some guided reading and discussion. And something that students got to engage on was sort of what are the medical symptoms, what are the diagnoses, the treatments surrounding Parkinson's, but also how does he use visual elements and artistic style to kind of communicate his physical limitations and his emotional struggles. But I think most importantly, students were able to take away something that you can't really get from just reading a textbook or sitting in a lecture hall, and that is the lived experience. Peter talks about his experience with his diagnoses and how that affected his relationship with his family, his mental health journey, and how eventually he used graphic medicine as a comic artist himself as a lifeline. And I think one thing that we can definitely take away from this core event that we have is the appreciation of comics, once again, as a way to not just learn about a medical condition, but the person in front of the condition.
So another thing that we really emphasize as a club is that content creation aspect. So I personally come from I published my own webcomic about gardening during the pandemic when everything was going crazy. And so my background is CS in education. How does someone get into graphic medicine? And I think we really wanted to provide more spaces for people who have random interests, who don't even know medicine or just like to do art, and provide a way for them to still get involved, still be able to share their work, still understand how comics play into this. And so we started out with the e-board, and we were creating these comics, and we were bringing on more content creators onto our e-board. We knew that we wanted to make something like a program called Medical Media Mentorship, where we essentially do that. It's a month. We're still in the middle of it right now, actually, but in the past few years, we've done 5-week programs where we bring these small groups together, people from different parts of BU, that don't really clash usually. And they get to talk, they get to research a topic that they're interested in. So someone did stuff about marathons or strokes, or energy drinks. Are they actually helpful for us? No, they're not. But they're able to have these conversations that they're not able to have. And when we're in such an academic setting all the time, you're not able to draw a lot. So a lot of people who are from these bio programs were saying oh, I never get to draw. I never get to do any art. So this is really refreshing. And Graphic Medicine Zine, that was just our further extension upon that. How do we bring people from our social media, people from around the world, they are also like showcasing their art. People are writing about their experiences as we've learned from today, from the other speakers, and we wanted to be a platform for that too. And so as we're continuing to build momentum, build in the future, we're continuing to, build our base in BU. We continue to collaborate with different clubs like KDSAB, which is kidney disease screening at BU, and Hearts for the Homeless, which is also a screening thing for homeless people at BU. And yeah, we're just trying to find like more people. We continually like meet new people that are like, oh, what's graphic medicine? Like, how do you do that again? So I think like the more that people can put a face to that, like they know, oh, you're the person that draws that, like they can start these conversations, and that like snowballs into our other things that we're interested in too.
Yeah, absolutely. And some plans we have for the future that we've already begun rolling out is sort of exploring graphic medicine at the intersection of art, healthcare, and science. And so one way that we explored expanding that is sort of what are the professional careers or professional pathways for doing so. And so this past month, actually, we hosted a tour to the Boston Children's Hospital, which has a creative arts department, where we got to learn about how different health professions, such as senior art specialists and child life specialists, interact and collaborate to use art to directly impact the lives of patients. In the future, we plan on hosting a guest speaker event featuring a medical illustrator, but also small little plug if anyone's interested in speaking for us. We would also love to invite any other professional perspectives. And then very lastly, our third goal, one thing that we've been looking to do is also break out of that BU bubble. How can we impact audiences from the greater Boston community? And so two ways, we plan to collaborate with two nonprofit organizations that engage in youth mentorship. And so we hope to combine parts of graphic medicine, the educational aspect of it, but also the intrinsic creativeness from kids to learn about science and art. And so two events we have planned up is a candy cell workshop, as well as a cardiology workshop, following with guided reading and DIY heart model activities. So all in all, through our journeys and our projects, I hope we're able to demonstrate sort of the impact of graphic medicine and its use for learning empathy, fostering creativeness, and also seeing its value in health education and storytelling.
Yes, so here's what I'd like to propose for the last 10 or so minutes. It's going to be a little awkward, but I want to invite all the panelists up here together. We'll have chairs, we can sit, and of course, we'll invite questions from the audience, but I also want to suggest the panelists are welcome to ask each other about their work. So if I could ask today's speakers to come on up, stand awkwardly near each other.
My favorite pastime.
I understand, it is a big ask. It is a big ask, but we'll start with the audience. If there were any questions you wanted, either for this, look at this incredible assembly. I just wanted them together. Wonderful. Are there any questions from the audience that we would like to address? Yeah.
So I have 3 questions.
Well, let's start with one, but go ahead.
Scarlett first then. Very impressive talk on previvorship. I was interested in, because you've read a lot of this cancer stuff, I can tell. What are the similarities and the difference between someone like yourself who's at risk for cancer but has yet to be diagnosed versus someone who might have a cancer, but say it hasn't metastasized, so you're getting treated, you're getting chemo. Are the anxieties the same? Are they different? What's going on there?
So I can only thank you for the question, first of all. I can only really speak on my experience as someone who has not had a cancer diagnosis yet, but I'll provide my best answer. I think that the experience can often be very similar, especially if someone is waiting for like CT scan results. I think that there's a lot of the same scanxiety. It might be on a different level now that it's kind of like closer in the face. than like being a pre-vivor who hasn't had a diagnosis yet. I think that many of the things are the same, and I think that there are like certain like magnitudes that come with like being a cancer patient waiting for like waiting for like metastasis results versus like being someone who has not had cancer yet. Does that help?
Before we get to Athos's second question, let's mix in if there is any other question. Yeah, we'll bounce back.
This is for the, first of all, great job, everybody. I guess I'm curious, is there any data out there showing the efficacy of like educating through conflicts? Like in different experiences and things like that?
I can speak to that, or if anyone else would like to speak to that. I can at least point to just the limited studies I've done, increase adherence to medicine prescriptions after the fact, after they're dismissed, decrease in emergency room visits, decrease in anxiety among patients, boost in empathy among doctors in training. So I'd be happy to shoot an article along, but we should gather more data. There should be studies that are quantifying what we have as largely non-quantitative, qualitative is the word I'm looking for, which is largely qualitative, but I'd be happy to share. Sorry, guys, didn't mean to steal that from anyone.
I was wondering.
I want to see the papers too.
Yeah, we should make something, right? You should draw something. Who's next? Back to Athos, or do we have another? Okay.
The graphic medicine club, I thought was interesting. You started that. Is that like for people, like who is coming to your club? I'm curious. Is it mostly pre-med students, or is it a really broad range?
I can speak for at least like the MMM program. We have like graphic design people. We have some like people that are like pre-PA, pre-med. I've had some like bio people too. But also like I also know that I've brought in a lot of people who are from like BS or something like unrelated theming. And I think there's also some like people who are interested that are like pure English like communication. So like the majority of people who like immediately are like, oh yes, graphic medicine, I understand the medicine part. Like those people are probably the med students, like pre-med, pre-PA, that kind of track. And then like the people that grab onto the graphic part are like those who come from like a more diverse one. It seems that.
Yeah, just adding on from that, kind of taking some information from our e-board. Actually, I think our e-board is pretty diverse in the things we study. I study human physiology. Iris studies computer science and education, but our chief content creator, she is a biomedical engineer. We have other content creators who major in art. We have like another content creator who is hoping to become a dentist. So just a lot of different disciplines. And I think the best part about what we try to advertise or like market our club is as an organization that sort of welcomes any interest in any aspect. So whether that's your artistic talent, or maybe your interest in doing scientific research or content creation, or maybe just learning a little more about your own health through hearing other people's experiences with books and things like that. I think, we welcome so many people from so many disciplines.
Okay, yes, please.
Hi, so I'm a grad student at Harvard that studies media medicine and health, and I spent the past few years being illustrated for Doctors Without Borders, but I'm new to comics, and if you tried sort of like non-sequential sort of storytelling, what do you find more effective, like this comic form of like sequential storytelling versus something that's a little more like kind of like one time frame, like say.
Yeah. Most of my memoir is less sequential. A lot of times I'll do a single page that maybe has different elements to it. All of a piece, all happening at once. Sometimes I'll zoom in and have like an inset that shows detail of the larger image. The one page that I focused on today is the outlier in my book. I think, again, looking at the vast variety of the ways in which people tell stories visually, there are no rules. If you can make it work, go for it.
Yes, please.
This question is for Annika. I know you, with your experience, distilled like the most optimal visual techniques to use within the medium, or like, yeah, the medium of comics for more informational pieces. Is there a like technique that you're like, it would not really work with how, I guess, rigid the things you're communicating on?
That's such a good question. I mean, I would say first of all, the four things that I brought up are, I mean, they were just the ones that I also have the most examples for, and I thought would be interesting to talk about, but there are plenty of other like, just literary and artistic devices we can use. I think it's more in there's not any single bad one that I've basically right now, but I think there are, like kind of what I talked about in terms of creating metaphor, there are devices you have to be more careful about, like going too far into a creative sense, that they might risk communicating something that's too vague to a patient, specifically in like the health education context.
I could connect something that both you're touching upon, and I think Helen also touched upon, is we have to be on the lookout for what we think are universal symbols, but actually are not, are actually culturally specific. I like that you put the headlamp on one of the doctors, because even if that's out of fashion, even if that's not state of the art, it will for a certain population communicate something. But if you're trying to go cross-culturally, globally, or into a different, just into a different culture, I think there's additional mindfulness that has to be put into how we imbue objects. What does a stethoscope mean? And to one person, what does a vial or a syringe? Does that mean health, or does that mean harm in the form of a syringe? So that might speak to, I think you've all been very careful with what you selected, but it's worth bringing up.
And also one more thing I want to add about that is also like a call for research, and like that's really what my lung cancer comic is specifically doing, is we're structuring our research as like a step-by-step development of the visual. So we've created multiple of these like smaller handouts, and now we're doing an intermittent research phase that targets the use of like specific devices, and we still haven't gotten data back, but it could be that there are things that are not receptive towards audiences that we thought would be, but yeah, we need to research it. And also like, people are saying it's targeted towards a specific audience. So something might work for some people that doesn't work for another. So it's all.
In our previous comments, we had a reflex hammer as the icon, which looked to some people like a tom. So we had to be especially careful.
Right.
Well, on that note, and you using a psychotropic medication, if I'm saying that correctly, did you guys ever do like an A/B test with them, like a different style comic, try different colors, anything like that?
Well, we're doing that, at least with my lung cancer comic. That's like, actually, we're doing a trial in November, which is all survey based, but we're actually going to use the two panels that I showed with the therapist comic versus the doctor comic, where they're citing screening to see the extent of humor. But it is complicated to research because also everybody's art looks different. So something that I draw might, we can try to generalize it, but somebody else's hand might not do the exact same thing. But
And we got
yeah.
time for one last comment.
Annika, you said you were on the squad, emergency squads, or EMT when you were in high school?
Yes.
What about a little graphic memoir or zine about that? Because I come from a really small town of 1,300 people, and my father was very ill for the last 6 months of his life. He had a bunch of runs, and there's nothing like those folks coming up the driveway to help us. And that's a really important role. And to have done that in high school is amazing. I just think that'd just be an interesting little zine for, because I don't do a book on it, but that's a great, I would love to see somebody write about that experience. And that's one graphic medicine comic I don't think I've seen, not that my experience and reading experience is vast, but that's my suggestion.
I'm sorry we couldn't get to all the questions. I love the enthusiasm and the interest, but I want to get us upstairs for the closing remarks. So once again, thank you all for being here today. Come join us for our closing. We have some arts and science, but no, one hasn't informed yet. I think it should.
Great talk. Well, thanks for sending that over.
My pleasure. Yeah, I thought it's out of date, but it's something we can build on.
Yeah.